Hello, and welcome to this episode of the Menopause Health Podcast. And I just want to, before we get into the show, I just want to thank you. It means so much to all of us that you're taking the time to listen and educate yourself. This podcast is a labor of love. And on behalf of myself and the production team, we are so grateful to have you here. In this episode, we're going to be talking about pelvic health. And I learned so much in this episode, including facts about how our pelvic health is directly related to our efficacy of hormone replacement therapy. We're going to talk about lymphedema. We are going to talk about cancer. We are going to talk about how to do self-screening. And I can promise you, after being in this space for quite a period of time, I learned a tremendous amount from our guest today. And before I introduce her and get into the show, I just want to say that this episode is brought to you by the Pause.ai. And our mission at the Pause is to make perimenopausal care and menopausal care accessible at your fingertips on your mobile device. So check it out at www.thepause.ai. So my guest today is the founder and president of Lake City Physical Therapy, and she has 8 locations, and she has over 40 years of experience in the profession of physical therapy. She has a very strong background in oncology, sports, orthopedics, and she is a certified pelvic rehabilitation practitioner, and she's also certified with the International Lymphedema Management Certification, and she has her own podcast called the Femtech Health Podcast, which is tremendous. You definitely want to check it out. And in this episode, we're going to talk about what it's like to sort of, I guess, have this intuition that something isn't right, what to do about it. We're going to talk about physical symptoms, and we're also going to talk about the challenges that women face because they're ignoring this knowing that something is going on, but they're not doing anything about it. And I promise you, this episode is going to be illuminating for you. So let's go ahead, and I want to introduce you to our founder and health practitioner, Sheree Dibiase.
Welcome to the Menopause Health Podcast, your go-to resource for practical advice brought to you by credentialed health professionals and industry experts. Here is your host, Susan Sly.
Well, Sheree, we were talking and I was like, oh my gosh, we have a show we need to do. We have so many things we're going to be discussing today. And for everyone listening to the Menopause Health Podcast and really loving it, I just want to, as we get into today's topic, it's something we haven't discussed before, and we are going to be talking about pelvic health, which is, guess what, something we all share. But before we get into that, Sheree, I want to jump in and ask you, as an entrepreneur, as a specialist, and a mom, tell us about your own menopause journey.
Well, it started typically, as it often does, at around 48 years old, and I had a thyroid issue. So we'll just jump right in and I'll explain. I had a tumor on my thyroid. The tumor they actually saw ended up being benign, but then they actually saw thyroid cancer on half of it and they removed it. And then it started almost a snowball journey. In our household, we called it a perfect storm. Ended up happening during that time frame. So I didn't enter menopause, or should I say perimenopause, very easily. It was like a surgical intervention and then a bomb blew up. And basically it was like, oh my goodness, so many health crises, like all at the same time. And for somebody who had already been a therapist, a physical therapist, a business owner since I was 22 years old, and to suddenly be 48 years old and suddenly be the one who's actually out in the world searching for medical interventions when I'm a medical specialist. And really not getting the answers in any consistent way that helped me navigate that time frame. So about a year and a half, I was super sick. I had all kinds of health issues that happened, but you can imagine I didn't get put on thyroid medication after I had half my thyroid removed for a year and a half. So I mean, my body just slowly, went down that slippery slope, and it really took a big hit for not only our family system, my kids, my husband, all of us. It really challenged us and our business as well. My husband and I are both self-employed. We've been both self-employed all our married life. So it was a rough entry. And now I think back about it, knowing what I know now about all the menopause things and the entering into menopause, I'm like, wow, I wish I would have known those things. I wish there would have been people surrounding me who could have helped me maybe even understand them even better. Luckily, my sister-in-law is a medical assistant and she helped me a lot. But I think there's so many things we know now so much better than we did those years ago. And I think this is my passion, is to help women not be alone, to have access, to have good medical interventions available. There's a huge knowledge gap right now that's present, and we need to do better so that women, as they start entering this perimenopause, they're not alone. They don't go to a zillion providers. Most of the people who walk into my office have been to 5 or 6 providers and still no answers. And it needs to go from generalized knowledge base to individualized care.
Exactly. And that's what we're building with the pause and with AI. And I want to step back because recently I just had one of my girlfriends, super healthy, eats only organic, doesn't touch anything in plastic. And she got diagnosed with stage 3 cervical cancer. And she ends up, Sheree, going to the doctor for an earache, and she had been bloated and had some digestive things, but she didn't think a lot of it. And so the primary care practitioner, PCP, says to her, okay, well, I can't find anything actually causing this earache. Is there anything else you have going on? She's like, well, it's not a big deal, but I feel a little bloated. And the PCP starts palpating her abdomen, and she gets my girlfriend is like, oh my gosh, that hurts so badly. And she ends up going for tests, and she has these masses on her ovaries. And the question I want to ask you, especially going back in time, because we want women to remember this core piece that it is up to us. Women's health has been underserved, it has been under-researched. It's up to us to take control. Going back, what were some of your early symptoms? Because suddenly, there's always the body's giving us a message that there's something going on.
I know this will sound crazy, but I had my surgery in February, and slowly over that year's time frame, I just felt run down and fatigued. And I went to the physicians, and I had a couple of different people I saw, and I kept saying, I'm really run down, I'm super fatigued. And they're like, oh, well, you work too much, which, you're a mom, you're a business owner, you're always working. But by October of that year, I broke out with a rash, like a weird rash, like all over my body. And I was like, what? Like, it was just like, I think my body by then was like, okay, I've had enough. My thyroid obviously didn't have what it needed on board. And, then of course it affects your adrenal glands and it affects your reproductive hormones. And my reproductive hormones were all over the map. And I'd always been a steady person, with my menses every 28 days, like a religion. And so all these just weird things. And I would go back to myself back then and tell that person, hey, your intuition, it was right all year long. And I did fight and advocate for myself. But what happens when you look healthy, people assume you are healthy. And when you work, especially people who work at the medical community in particular, and a lot, people just take for granted that all these things. The problem is when it comes to your own personal health, you're so used to taking care of everybody else. I mean, come on, women take care of 80 to 90% of all their health care for their whole family system, their parents, their kids, their everybody, right? and we get overloaded. We're not used to, we advocate for everybody else, but sometimes I think we get in that position, we walk in that office, we forget, just like your friend did, to advocate for ourselves. So if something doesn't feel right, use your intuition. If that provider and you don't connect, move to a different provider. I moved through a lot of different providers to get the help that I finally needed to get my thyroid back where it was supposed to be. But it took me so long that there were so many other health crises in the middle of that, that it was not a good place to be. And I think if we can tell a woman anything, like if something doesn't feel right, you find someone to help you with it. And if someone tries to tell you, oh, it's all in your head, and you know, it's not in my head. I'm bloated. I've never been bloated before. I mean, one of my women that I just had, she had vulvar cancer. And, you know, I asked her, I said, did you know something was wrong? She said, I went in and it looked like a little disc. It was tiny, small. And she said, I knew something wasn't right. And I had to push, you know, to get somebody to do something, right? To biopsy it. And I think that's where we're at now, is we have to sort of help each other. Like if you're not getting the answers in the community that you're in medically, knowing like, hey, somebody out there is going to answer it. And no, don't just hand me an antidepressant or anti-anxiety medication and tell me, oh, you just need a little of this. And my women throughout perimenopause to postmenopause, constantly, that's the first order of business. And I say, hold on, like, let's slow down.
Well, and to your point, trusting your gut. And as women, we do not often prioritize ourselves. And this it's all in your head. And to the listeners of this show, if you haven't heard the story, in 2016, I had been in Africa and I came back and I was really sick. I had one doctor say, it's all in your head. And he gave me a personal development book. And I'm like, do you realize I've shared the stage with Tony Robbins, Mel Robbins, Pitbull, Gary Vee, like all these different people. I've run workshops where I have like helped women transform. I'm an author of personal development books. I don't need that. Another doctor told me it was PMS. What it was, Sheree, was an amoeba, and it was shutting down my organs, and I almost died. And so women get gaslit all the time. And just to level set, in the United States alone, it is one woman in menopause to 30,000 women in menopause to one certified provider. And you have to be your own advocate, which means, and this is going to be like the whole piece around this show, very tough love. Girls, I want you to hear it from Sheree and hear it from me. Yes, you have 5 million things you're doing, and you could be in business. You're an SVP of a company, or you're a director level, and you've got kids, or you've got grandkids, and you have a partner, and you have a pet, and maybe 5 pets. I don't know what you've got. And you're like, I don't have time. Yes, you do, because you're the one who is the pilot, the flight attendant, the co-pilot of that airplane you call your life. And if you don't prioritize it, it is all going to come crashing down. Sheree, do you want to say anything?
Yes, I do, because I think when we have that intuition and that gut, right? Like when I talk to the women that I know, I'm like, no, absolutely not. Oh, you got brushed off by somebody. It's easy for you to sort of step back and think, oh, it really wasn't something that I had. And I'm like, no, I have young women now, you know, who we are helping get diagnosed with endometriosis. And let me explain, so much of this stuff they have dealt with for years. I have women now in their 50s and 60s realizing, oh my goodness, I've had endometriosis like the majority of my life. And we have to teach each other, right, how to actually say the things that we need to say and not be embarrassed, not be ashamed to say, you know, hey, I don't know what's going on, but I don't feel good. And, you know, what happens now is that you teach one young woman in my office, and she tells 7 or 10 other young women, hey, you need to talk to this provider. They're going to listen to you. And I think that's the key, is that if we can teach young women to actually say what they need, stand up for themselves, you know, you can do it kindly, you can do it nicely, but knowing your body And I think teaching women to know their body, I mean, and that's what we do every day in our work in the pelvic health world. We are teaching young women, I don't care how young they come in. I mean, I have young women sometimes they come in, but they get their first period and there's issues that start up or things that are going on. And we're working with them, right? Because we're trying to help them have a quality of life, whether they're in their reproductive years or prenatal, postpartum, or whether they're now in perimenopause to menopause. And, you know, you and I know we spend 40% of our lifetime in perimenopause and menopause. Let's make it great.
Yeah. Well, and for some women, even to that point, every time I hear the 40%, I just make a face. So if you're just listening and you're not seeing us on YouTube or wherever you're watching us, I made the face. And for some women, it's even longer because of surgical menopause. One of Brooke Chambers, who we've had on the show, she had a hysterectomy, I believe, at age 32. And so she may live to be, you know, in her 90s, and she will have spent over 60%. And so the other thing, Sheree, is this conversation between mothers and daughters, or, you know, godmothers and grandmothers, or between women who are navigating menopause and perimenopause and that next generation, to teach them how to be advocates. Because learning how to be an advocate, if you have a healthy relationship with an older woman who is a mentor, it starts at home and learning, which leads me to, we were talking before we started the show about you being a pioneer in the space, especially as a woman. So can you share with everyone, tell us about your practice, your business, and what it was like to be one of the first women in your space?
So thanks, Susan, for asking that. I really appreciate it. In our space, it was pretty male dominated if you owned your own private practice. And I bought my first private practice from an older gentleman who was retiring. And literally, I had to talk to him for 9 months. He wanted to sell, but he didn't want to sell to a woman. And I had to
What year was
literally,
this? What year was this? Tell everyone.
okay, let's see. It would have been 1987.
Wow. So it's not, you know, like this is recent, you know, well,
Yes.
most people who listen to the show, they wouldn't consider 87 like the dark ages. So yeah.
It feels like the dark ages now, but literally I went to him I found out he wanted to sell, and I went to him over the course of like 8, 9 months to convince him that he should sell to me. And I was a professor at Loma Linda University at the time at the School of Physical Therapy. I taught there for 7 years. So he knew that. And he knew I knew all these people there. And he knew, you know, I was well respected there. And he still was afraid to sell to me. And it was just such a crazy story. And then years later, he came back to me. He actually visited me. And he said, with his wife, he came to my office. It was probably 10 or 12 years later after I'd bought it, whatever. And he said, he sat in my waiting room and he waited for me to be done with my patients for the day because he wanted to tell me, like, I am so proud of you. And I'm so lucky that I sold my practice to you. And at the time I did, I ended up getting a male partner at the time. But it's kind of crazy. By then I was on my own and self-employed and no partners. But it was just this, you know, it was me, you know, I was 25 years old and I wanted to buy this man's practice, and I had no mentors who were women. So my mentor, thank goodness, was a man who I had met in PT school, who's amazing. He's still my mentor to this day. And he laughs when I tell him all about my women's health work, because he's like, Sheree, you didn't learn any of that from me. And I didn't mentor you in any way, shape, or form in that. And I said, yeah, but you at least started me on my journey of me believing in who I was and what I was. And I think my goal now is, you know, I have a lot of young women who work in my organization, work in my team. And I am all for them mentoring. And we have a huge health initiative that we're going to do in our own organization this year. And it's literally to do what? To help raise up the next generation of women. And maybe if a mom didn't know how to talk to their daughter, guess what? They have us, right, to talk to. And so we have we're going to have on our WebEx, as part of our internal communication, our mom's mentoring group. Do you know? And you
Yeah.
probably know this, but like wherever I go, people like, hey, after we have dinner, can I talk to you for a second? Or I'm at a function with women and I need to ask you this for a second. And pretty soon the whole table, is talking about pelvic health, sexual health, bowel, bladder issues, etc. Why? Because my mom was a nurse, but she didn't know how to talk to me about sexual health and all these things. That was not the time frame of it. And we're trying to change this, right? So that we don't have any knowledge gaps, and we don't have information gaps, and we don't have implementation gaps. Because if we don't do this, then we're not serving the next generations well. So yes, I love it that I now am able to mentor others, and I'm thankful for my male mentors, but there was none then. And I think we as women, I don't care what profession or what field we're in, we need to step up to the plate. We don't think we have anything to offer other people. Yes, we do. We need to tell them, hey, I walk through all these things. I've been self-employed for 38 years. Like, I've learned a wealth of knowledge and a wealth of things. And why are we doing it? Because we care about the next generations coming, and we want them not to have to stumble around maybe and make the same mistakes as we did, right?
Absolutely. And I love that concept of the initiative, just really, the peer-to-peer mentoring, and just, no matter what we're going through, someone has gone first, right? And it being in your space, one of the first women to go first, just like in my space in artificial intelligence, I was one of the first women, if maybe the only woman in the United States, to deploy computer vision at scale, as a co-founder of my previous company, right? So it is, someone's always gone first, no matter it is in some way, shape, or form. I want to ask you, have you seen a greater prevalence of certain issues in pelvic and sexual health more recently than you were seeing back in the 80s? Like, are there some trends that are rising that our listeners should be aware of, especially as we're lovingly kicking their booties to go get their checkups and everything?
Susan, I think the biggest thing that really, when I first started in this space, I was really into sports medicine. I had an orthopedic sports medicine clinic, and we were really pushing. We loved our women athletes. We took care of men as well. But then I had my own baby, my son Cody, and I definitely changed. My vision started to change then, because I realized, women being pregnant, it's an athletic event, literally, for 9 months. And then we're just kicking them back out on the field and saying, hey, good luck, have a great time out there. Like, I don't know who's going to take care of you, but like, see you around. And then you get into all kinds of health issues. And mine in particular was, again, I don't know what it is, entering in the reproductive years, just like I entered into menopause. It was a full on whoa. And I had a huge baby, too big for me. And I really worked during labor and delivery to try to use my voice to say, I need a C-section because I'm not doing well. And
I need to pause for a second, because you can't just say something like that and not tell us how big he was. And as a sidebar, Cody, Sheree's son, has been a guest on my other show, Raw and Real Entrepreneurship. We will put the link in the show notes. It was such an amazing interview. Love that kid. Congrats, Mom. But how big was he? Need to know.
So at that point in time, I was tiny, and he was 9 pounds, 3.5 ounces, 21 3/4 inches long, had the cord around his neck twice, and just wouldn't advance. And innately, I knew something was wrong. And I literally said to the physician, hey, I need to have a C-section. And he said, oh, I think you're doing okay. And he said, I'm going to dinner. I'll be back in 2 hours. And literally, thank God, my mom was a nurse. She was retired from nursing at that time. But then my girlfriend was a high-risk labor and delivery physician in Washington, D.C. Luckily, she was visiting me during this time. She was in the room. And for 2 hours, that girl took care of me, turning me every position every time he would try to advance and his heart rate would go down. So literally, when that kid was born vaginally, which was a terrible deal, but literally the crash cart came in, all the pediatricians came in. I mean, he wasn't breathing, he was blue, and they couldn't get him out. First off, his head came out, they couldn't get the rest of him out. And I share these things in a little detail, maybe more than I would normally, but I think, Susan, I'm saying it because I innately knew there was a problem. I mean, I live in the musculoskeletal world every day, and no one was listening to me. And I was like, wow, this is sort of crazy. Like, I basically was like, no, I'm pretty sure I need one. This kid's way too big. Like, something's up. And sure enough, I then 4 months later had to have a pelvic floor reconstruction. And then my whole world in the medical arena as a physical therapist changed. And I pivoted into prenatal postpartum care 30 years ago. I started then, you know, part of this already, but I started working in the breast cancer world, oncological world. I started looking at women and saying, why are we not serving women well? I had one of my top neurosurgeons at our hospital reach out to me with a patient and they didn't know what to do with her. She had lymphedema. They said, please, Sheree, help us. At that point in time, I didn't know the work yet. And the moment I saw her, I was like, there's no way that any woman should ever have to suffer with this. And she had gone so far that her arm was just weeping fluid out of it because she had been so mismanaged. And at that point in time, I said, absolutely not. And I started training myself and my staff in lymphedema and oncological work. And you know what happens when you do that? You fly right into the whole pelvic world. And suddenly my world was like, oh my gosh, here we go, right? And if you asked me when I graduated, would I ever be doing that? I would have been like, what are you talking about? No one knows this work. No one trains in it. And because I had no one to teach me, I just started learning and doing all the work and became very adept at learning and putting puzzle pieces together for people. But I was always like, no woman's gonna suffer on my watch or my organization's watch anymore. And I think that's the beauty of the work the pause is doing. I'm just telling you, in the, you know, perimenopause, menopause, postmenopause space is that same passion of like, no woman's gonna be out there alone. We're not leaving anybody without the medical interventions or some way to find out how to get the care they need. We're not doing this anymore. Women deserve better and they deserve more. And we're destroying families and family systems when we don't look at people and say, hey, this woman doesn't feel good sexually. She loves her husband, but she's not able to participate because she doesn't feel good. Why doesn't she feel good? Okay, let us help her. And that way we keep families together and we keep systems healthier if we can interact in that way and protect them.
Absolutely. And to your point, that we as women, don't have the time to go seek out multiple answers. And that's where, with what we're building with the pause, it's the precursor to seeing Sheree, to seeing someone who is knowledgeable and certified and getting support, and then having the AI point you in that direction. And Sheree's company will be one of the ones that, if you're near any of her locations, that you will end up there, because that's the big piece, right? Women don't have the time and we need to get them the care right away. You said, I want to talk about lymphedema for a moment. I remember back in the 90s, I was a personal trainer and nutritionist in Toronto, and many of my clients were either PhDs, physicians, women who were post breast cancer surgery. And I had one client, God bless her, and her arm would it was so big. It was bigger than a linebacker's thigh. And there weren't a lot of people trained in this. And it came up for me again. And I would just, I learned from her PT. So at the end of her sessions, I would do a treatment on her because she was suffering so much. And when I had decided to have my breast explant surgery, one of the first things I did is research post-op, and I went to a lymphatic healing center where all of the therapists are certified in lymphatic drainage, and I recovered so much faster. And I see a lot of women with swollen legs. Their lymphatic system is not working. Lymphatic system in the pelvic area, obviously, that's why we get leg swelling. And that is another piece. That's an indicator. Yes, this is not like, oh, you just go on some weight loss drug because your legs are swollen, but you're not swollen anywhere else. That's an indicator that you need to get help. Okay, Sheree, I want you to rapid fire. What tips should women like, right now, what should they be doing about their pelvic health, their reproductive health, and what are some signs that they really, I want to do an intervention here for these girls listening, that they need to like stop what they're doing right now and they need to make a call.
Well, I think one of the first things is if you feel heaviness and pressure in your abdominal pelvic region. So heaviness and pressure is a signal that the lymphatic system is not working well at all. So, inner thighs feeling really full. My patients will tell me all the time, oh, I'm just fat down there. I'm like, no. I said, you're not fat down there. Your abdominal pelvic region with its lymph system is not efficiently draining. Why is it not efficiently draining? You always go back when you see things like that and say, who helps drain fluid, right? The heart and the kidneys fight over fluid all day long, every day. So if we see areas or region, we go back up the chain to say, hey, who's not efficiently helping with the drainage of this fluid? Any surgical procedures that are done where there's, tissue that's been cut through, whether it's a laparoscopy, whether it's minimally invasive, it doesn't matter. You're piercing through the system where the drainage system works for lymphedema. So heaviness and pressure is the first sign that the lymph system is actually overloaded. So when people tell me, oh, I feel heaviness and pressure, like in my arm, I'm like, or like one of my boobs is thicker, heavier. I'm automatically like, okay, what's going on? Who's blocking what of the drainage of the lymphatic system? Because there's a blockage somewhere, and suddenly I have heaviness and pressure. And now I get my visualization skills really good because now I can inspect my body and I know what it looks like. And I'm all after women right now saying, hey, check your breast, right, for nodules and all these things. But now we're teaching women to do what? Monthly pelvic checks, pelvic floor checks, getting out their mirror, looking at their floor. Oh, do I have a huge labia that's swollen on one side, but it's thin and looks fine on the other? The drain system for each side of the pelvic floor alone drains to one side of the body versus the other. So learning your body and actually looking at it. I mean, I was in a room teaching. I asked out of, there was probably 16 people there, 20 people. And I asked, how many of you have ever looked at your pelvic floor? And I held up a mirror. And one gal in the back held up her hand, and she was my youngest gal in the whole room. And I said, you've got to be kidding me that no one else has ever looked at their pelvic floor with a mirror. Why are we looking at it? Because we need to know what it looks like. Because if something goes wrong with it, we need to know what to do. So just like we're going to test anything else, we're going to look at the floor to make sure everything looks right. Just like you and I pay so much attention to our face, right? Creams and lotions and washing and da-da-da. Like we should be looking at this area of the region of our body that no one maybe's ever talked to us about. But why? Because it gives us indicators, just like you said, hey, if something's wrong, if something looks discolored, we look for redness, rawness, or if tissue, especially in women who are perimenopause to starting menopause, we look at their floor. If there's areas of whiteness that there was never areas of whiteness before, or tissue doesn't look pliable, or it feels achy or stiffer, those are indications something's going on. And even if you go to OBGYN, they don't know who does this every day, all day long. I mean, pelvic floor PTs and occupational therapists, this is what we do every day. We're looking at tissue just like we would look at it if you hurt your arm or your leg or whatever, to say, hey, does that skin look right? Does the texture of the skin look right? Does it look pitted? Does there look like there's pinching or pulling in an area that doesn't look like the other side of the floor? So I want people to have the vision of, just like they do breast self-exam, they're going to do their abdominal tissue. They're looking at it. They're looking at their pelvis from the front, and they get a mirror and they look at their floor. Because these are the cues. And if you have somebody who said, I never had a leaky bladder, and all of a sudden out of the blue, I have a leaky bladder, or I've never had constipation, and now all of a sudden I do. Those are cues. Oh, I never had pain during intercourse, and now I do. Those things are that's the dinger bell, right? That goes off. And you and I are like, no, we have to address these things. And no, you don't get to wait 7 or 8 years before you tell your provider, because that was the data years ago, just so you know, that literally a woman would have a leaky bladder. She didn't tell anyone for 7 to 8 years.
It's
I'm
yeah, and everyone listening to this is the mothers, you need to talk to your daughters, because so I think about the age range you and I are in. No one was telling us to look at down there with a mirror. Like that was not happening. And it wasn't until like shows like Sex in the City with the iconic Samantha character, where I remember one of the episodes, she's like, I have a gray hair down there. And the girls are like, you look at yourself down there. She's like, don't you? Don't you know? And even
I know.
the breast self-exam piece, I don't know the statistics, right? Like, but it is not don't just wait for a mammogram. Like, you know your body, right? Like you said, Sheree, it's the intuition. Something's not right. If you're feeling it, you're not a hypochondriac. Don't be gaslit. Look for the changes. Look for the changes and talk about it. Like, we tell our little kids, like, I remember when the kids were little, I'm sure you said this to Cody, if you see something, say something, right? And what about ourselves? If you see something, say something. I love it. Final words for everyone listening.
I think, trusting your intuition is such a huge component for us. You have to understand, in the medical arena, we don't have enough research yet about this time frame. And so it's super frustrating, even for us as medical providers. I want you to know, we have all this real generalized medical information that we're given, but we're not always taught how to individualize it. So I don't want you to give up on taking care of yourself, because maybe a provider just didn't hear what you said, because there's going to be a provider that's going to hear what you say and say, I know what to do. I want to share a story. I have a woman right now that I'm taking care of. She's an occupational therapist. Love her. And it's crazy. She said to me one day, Sheree, like, I don't know if I should go up on my estrogen or go down on it or da. Like, and she's very intuitive. She's running around, and you're in my neighborhood, right? But she's like saying, hey, we've tried all these things. Sometimes I just want to give up on all of it and forget about it. And I said, absolutely not. That's not what we're going to do. We're going to work through all the puzzle pieces of it, right? With your provider, your other medical provider who's getting that hormone replacement therapy for you, and we're going to help you know what your floor should be doing during that whole time, because their pelvic floor health is a telltale sign if their hormone replacement therapy is working well, whether it's topical estrogen, which is one of the first line of defenses right along with pelvic floor PT, right? But, if a transdermal isn't working and you need an oral or you need a mix, don't give up on it. I want women not to give up on their body and their health, just like we don't give up on the people we love, and we don't give up on our monetary way to make a living, right? We never give up on this, but never give up on your health. And don't even make it an option in your head that you ever think you will. No, absolutely not. You say, no, my health, the people I love, and my monetary way to make a living, there are top three things. If I don't feel good, I'm not ever going to be able to love the people I need to, or work in the work that I've been gifted with. And we're not going to put up with that anymore. And we have to band together as women to say, no, we're going to make this, and we're going to do it better. And I think when I saw you, Susan, and met you at the FemTech in Arizona, it was so powerful, because I think it dinged my brain from the standpoint of like, okay, research. We need to now collect data. And I think the pause, because I think that's the direction. We have to use AI to synthesize data, to go through data, to figure out, okay, what are we doing well? What are we not doing well? Do we have different population bases that need different things? Oh, just because this population base did really good postpartum or with this on board, maybe this population base didn't. Well, how do we know? Because we've never done the research to know. So then we just throw everything at everybody, and then then people give up. And I'll just tell you, I've learned so much in the last, 12, 15 years since I was sick with my own journey and started perimenopause. And I just think we have to do better. And I think we can do better, but we have to do it collaboratively with all of us together, saying, hey, this is my expertise. This is Susan's expertise. These are these other people. Let's put them all together to make it really good for women going forward. Because, man, when women feel good, man, Katie bar the door. I see it in my community all the time. But suddenly their gifting goes through the roof because we're all gifted with different things, and we got to blow this thing up. And we're not going to do it if we don't take care of women physically.
Absolutely. I firstly, Sheree, you said so much there. From the heaviness and pressure in the abdomen, like these indicators, checking your breasts, the monthly pelvic checks, that the pelvic floor health is an indicator of HRT effectiveness. I've never heard that before. And the bottom line is that we have to, as women, take care of ourselves as well as we take care of everyone else. So Sheree, thank you so much for being on the show. You're so amazing. You're such a force in the world.
Thank you, Susan, so much for having me. And it's been a pleasure. And thanks for having me at the FemTech Arizona. It was amazing. And it really is. I think if we all work together to collaborate, work on research, and keep moving forward, it's wonderful. And thank you for the pause. It's been a great adventure for me to start working through to see all of the stuff Harmony does. I love it.
Well, thank you, Sheree, for that. And for everyone listening, if this show has been helpful to you, share it with a girlfriend, share it with 3 girlfriends, give us a 5-star review. We read all of those reviews, and definitely tag Sheree and I on social. All of her links are in our show notes. And by all means, go back and listen to past episodes, because the most important person you need to educate on all of these things is yourself. So once again, Sheree, thank you so much for being here.
Thank you so much.
All right, everyone. With that, this is another episode of the Menopause Health Podcast, and I will see you in a future episode.
This Menopause Health Podcast is brought to you by The Pause Technologies. To find out more, visit thepause.ai and follow us on your favorite social media channels. Don't forget to hit the subscribe button, share the show, and connect with us. We will see you in the next episode.